Good morning, one and all. Hope you all are doing safe and healthy during this pandemic. Today is August 1st, and we, the team of Kangaroo Care, are here to celebrate the beautiful journey of breastfeeding through World Breastfeeding Week. As WHO suggests, it is the sole source of nutrition for babies from birth until 6 months. It is the most effective way to ensure child health and survival. So, let's learn more about this through our wonderful team. Obstetrician Dr. Preeti Gowda, Chief of Nursing Major Joyshri, Pediatric Registrar Dr. Sneha, Dietitian Swati, and our lactation consultants Rupa, Shashikala and Sumala.
Hi, I am going to say about benefits of breastfeeding. Breast milk contains natural nutrients which is good for your baby. It contains fat, protein, simple carb, beneficial bacteria and enzymes, and it promotes mother and child bonding. Initiate breastfeeding within half an hour or as soon as possible to maintain baby's temperature and glucose level. Breastfeed improves immunity and it has no allergy, low infection risk as no bottle feed, appropriate nutrition for term and preterm babies. Breastfed milk is also live fluid. It cannot be compared with any other milk. First milk is called cholesterol. It's a sticky, transparent milk which is rich in immunoglobulin. It's easily digestible and readily available. Breastfeed also help to increase good mental health for the baby, and survey says breastfeed babies have higher IQ. Breastfeed prevents diarrhea, respiratory disease and long-term disease like cancer. It has got mother benefits also, prevents breast abscess, breast cancer and ovarian cancer. Prevent postpartum depression also, natural weight reduction and save your time and precious expenses. So, I strongly suggest all the mothers should breastfeed your baby exclusively for 6 months. Thank you.
Let's know more about breastfeeding position, latching, burping and timing. Before start breastfeed, first you should feel comfortable. So sit with back support and be relaxed. Let's know about the position one by one. First position. You should hold your baby with your opposite hand. Suppose if you want to feed your left breast, then you should hold your baby with the right hand. Support your baby head, shoulder and whole body in a one line. And head should be slightly elevated. And baby face should be faced towards your breast. In this position, you should hold your baby in a same hands. If you want to feed your left breast, then you should support your baby with the left hand. Support baby head with your elbow and with your palm baby's body. And baby face should be faced towards your breast and head should be slightly elevated. In this position, you should hold your baby in a side leg position. Baby face should be faced towards your breast and support baby head, shoulder and whole body in a one leg, and head should be slightly elevated. And this position is more comfortable who had a C-section and thin babies. Silent position. In this position, how it is showing in picture, mother should lie in her side next to the baby. As it is showing in a picture, lie on your side, take the baby towards you in a side position and support your baby back with your palm or roll towel. And this position we are not recommending before 3 months. Latching is very important. After positioning your baby, take the baby towards your nipple, not a nipple towards the baby, and touch your nipple to the baby's upper lip, and it will stimulate to open the baby mouth widely. And once baby open mouth widely, immediately you should insert your nipple and darken part of the areola into the baby's mouth, and baby will start sucking. Baby's neck should be slightly extended and baby's nose should be open. If you feel pain in the nipple while baby is sucking, that means latching is not correct. You should re-latch after disconnecting baby sucking. And in good latching, you won't get nipple sore or cracked nipple. It's very important to birth your baby after each feed. There is a two technique. Let you know the first technique. In this technique, you should place your baby on your shoulder. Be careful, baby's nose should be open, and you should start patting gently with a mild pressure. Second technique. In this technique, you should place your baby on your lap, and head should be supported with your one hand, and start patting gently with a mild pressure. First feed should start within half an hour or as early as possible. Feed your baby every 2 to 3 hours. Duration of feed should be 15 to 30 minutes.
As all of us know, breast size starts increasing gradually throughout pregnancy and delivery. Breast starts increasing as early as 3 to 4 weeks of pregnancy itself. As the breast size increases, it becomes very sensitive and tender. Sometimes, if there is sudden increase in breast size, you may notice stretch marks also. These stretch marks can be treated with the normal moisturizers. Then there will be appearance of some glands on the areola, which helps in providing small amount of secretions. These secretions will help moisturize the nipple also. So whenever you take bath, do not use soaps over the breast. From 16th week of your pregnancy, the breasts are able to produce milk and small amounts of strong colored fluid called colostrum. This colostrum forms a crust over the nipple, which should be washed regularly only with warm water. Soon after delivery, the breast size increases and becomes even more tender due to increased secretion of milk. How to hold the baby, how long to feed the baby, how often to feed, all such informations will be provided by our lactational consultant. Thank you.
Hi everyone. Taking care of your personal hygiene needs after having your baby is important. Washing your hands frequently helps to stop germs from passing between you and your baby. When to wash your hands? Always wash your hands before breastfeeding, after changing your baby's nappy, after contact with any body fluids such as vomit, mucus or saliva, before holding up your baby. Personal hygiene is very important during breastfeeding. Especially extra precautions are very important during COVID-19, such as wearing N95 mask, hand washing and restrict visitors. In the personal hygiene, it's very important to keep your nipples clean, change your nursing pad often, avoid tight clothes, change your bra every day, create a good hygiene habits. Thank you.
Hello everyone. Kangaroo mother care means skin to skin contact between mother and baby. Place the baby on mother, bare on chest. Advantages of kangaroo mother care: it is beneficial to the mother and baby. It helps in early discharge of babies. It promotes better mother and infant bonding. Mother is less stressed during mother care as the mother is more actively involved. Breastfeeding gives healthier and more intelligent babies. Kangaroo mother care promotes effective thermal control, prevention of infection, and parental bonding. Thank you.
As a new mom, you will be receiving a lot of tips from everyone and everything around regarding breastfeeding. Some might work and some might not. And you will end up getting confused regarding what to do. So here I am to tell you few things about breastfeeding. You should exclusively breastfeed your baby for at least 6 months and then continue it for another 1.5 to 2 years. Eat balanced diet, eat healthy foods, lot of fruits and lot of vegetables. Drink at least 3 liters of water per day. Practice skin to skin contact. That will help in increasing the bonding between you and your baby. It will increase in the weight gain of your baby and also in your milk secretions. Do nurse your baby whenever the baby is hungry, regardless of the place and time. Learn to express milk and how to store it. So, whenever you are not able to breastfeed the baby, you can either give your breast milk through a palada or through bottle. Be patient. Breastfeeding is a whole new process for both you and your baby. Do not give honey, sugar, or donkey's milk or cow's milk to your baby. Do not switch the breast early. Once you start feeding your baby, feed for at least 15 to 20 minutes from the same breast. There is something called as fore milk and hind milk. The hind milk is the one, that is the thick milk is the one which satisfies the hunger of your baby. So whenever you feed, try to feed from the same breast for at least 15 to 20 minutes. Do not consume alcohol, smoking, or any kind of drugs during pregnancy or during lactation. Do consult your physician to take any kind of drugs. Take only prescribed medications. If you experience any kind of pain during breastfeeding, that means there is a mistake either in the latching or holding or the position of the baby. So do not hesitate to ask for any kind of assistance, either from the lactation consultant or your other consultants or family support. Do not quit breastfeeding when you are sick. Consult your doctor and take prescribed medications. Do not get discouraged during breastfeeding or do not doubt about your ability on how you are feeding. Thank you.
Breastfeeding and diet. Breastfeeding is a very demanding period in a woman's life. As breast milk production is an ongoing process, continuous supply of energy is required. Hence, eating a wholesome diet is an important perspective of breastfeeding. Let's talk about galactogogues. Galactogogues are natural ingredients like food and herbs that help in increasing milk production. Fenugreek seeds or leaves, methi, these are rich in phytoestrogen, calcium and iron. Sepu, sabzige or suiki bhaji. These are also rich in calcium, iron and vitamin C. Ginger root, it's a very rich source of calcium and vitamin C. Milk and milk products are a natural way to add calcium to your diet and it's also high in vitamin D. Shatavari, or also known as asparagus extract, is an excellent way to enhance your lactation. Garlic pods, they are rich in vitamin B, vitamin C, it also stimulates lactation. Rajgiri, it's rich in vitamin B and calcium and iron. Adavi or garden cress seeds. These are a great way to add folic acid, vitamin A and vitamin C into your diet. An ideal diet for lactation. A well-balanced diet with all the 5 food groups is ideal for lactating mothers. Carbohydrates include wide variety of carbohydrates like rice, wheat, ragi, jawar, millets, bajra in your diet. Proteins. Good source of protein both from plant and animal origin should be included like dals, sprouts, nuts, egg, chicken, fish are a great way to add proteins. Talking about fats. Good fats are very essential for the absorption of fat-soluble vitamins like A, D, E and K. Hence include avocados, egg, olive oil, sea fishes, ghee, coconut oil, nuts, almond butter, flax seeds, pumpkin and melon seeds and walnuts. Milk and milk products. They are a natural rich source of calcium, protein as well as vitamin D. Include milk, curd, buttermilk, whey water, etc. Water. It is a very important factor in lactating mother's diet. Plenty of fluid should be included to ensure hydration. Thank you.